I think it was a great session, and one of the most important things I heard was how improved the outcomes are. You gave a wonderful overview over past couple decades of improvements in drugs and outcomes. What did you take away?
Well, I thought that the results of transplant for aplastic anemia have improved dramatically. So it was really exciting to see the results that were coming from your team and to see that patients that historically had no transplant option not only have a transplant option now, but have a really, really great probability of being cured.
Well, and I think it was also neat that we spoke about transplant for aplastic anemia and really good outcomes there, but also for MDS, which have continued to improve over time both in Europe and in the US through Dr. Kroger's talk.
Yeah, and I think his talk was interesting because it's been debated for years. When is it an optimal time to transplant patients with myelodysplastic syndrome? And I think he gave a very, very good, comprehensive perspective in terms of why it might not be quite time yet to be taking patients with low-risk MDS and bringing them to transplant. And maybe the old algorithm of the more advanced, moderate to high-risk MDS should be the patients that we transplant, and that algorithm shouldn't change yet.
I agree. I think another key takeaway was really that transplant is something that should be at least discussed and considered for everyone, even if not utilized at that time, just so it's in the comprehensive care to give these patients a path to cure.
Yeah, I thought the discussion about what is the benefit of getting cytoreductive therapy before going to transplant was particularly well done. And I think that it framed that unlike some malignancies like AML, where we try to get people into an MRD status, that giving patients cytoreductive therapy may not actually be helpful for them. And I thought he was more definitive than I've heard other people about this controversial area.
It was very well done. I think really open discussions from the beginning, and I talked a little in my talk about balance of risk and what people have a tolerance for early in their disease, later in their disease, and I think that applies to aplastic anemia, MDS, and all bone marrow failure conditions.
Yeah, I think it's important that patients be forthcoming with their questions and not be shy to ask about what are the pros and cons with transplant as opposed to non-transplant therapies, and to actually have a look at the data and to make a decision based on the data and also what their own personal goals are. Because that data may impact people, the same data may impact people very differently depending on their personality. There was a comment about would you want a transplant versus trying to take some pills for a couple of months. The person that asked the question just said, I would rather take the pills for a couple of months, but clearly there are other people that would rather get their disease cured as quick as possible.
Agreed. I think the regimens are continuing to improve. Patients have better quality of life outcomes, and in aplastic anemia in particular, transfusion-free survival, off all medicines. And then you presented some really nice new data of other options for them as well.
Yeah, I mean, the options are increasing. The best news is that just, 10, 15 years ago, a significant percentage of the patients that we would see that could benefit from a transplant would not have a transplant option. And what we would consider non-conventional donors was always linked to mortality rates that were very high, at least 30%, sometimes as high as 50%. And it was sort of a last-ditch option. And it's remarkable to see those transplants that we considered the riskiest transplants. Now we're having discussions about them being so safe that they should be considered potentially a first-line option. So it is really amazing how quickly things have changed. The fact that patients have additional options is great.
And I think that's probably the last key takeaway, is that transplants are safer and don't have to be this feared unknown. If we talk about it, we look at the data, they can really be a very good option.